Join me in our national anthem and raise the flag. At the cross, and the rockets red flame of mercy. And now, and I like to save us and stars. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. James Edwards, invocation, please.
Just a week ago, we were talking about the team that came in and made such a destruction over multiple states, lost life, and that's nearly double since we talked about last Monday. And still in a lot of recovery. We can still look at people there. We'll continue to remember them. Still, I believe there's over a million people still without service and power service, and the water situations is kind of strange. So we continue to remember all those families that are still trying to recover and trying to rebuild, and also those families that lost loved ones. And then we're on the brink of another one going to hit that around the Tampa Bay area. Milton's supposed to be hitting sometime Wednesday afternoon. So our neighbors are hurting. They have families in those locations. So we want to continue to pray for those people. Also, all the responders, and the many people that are responding to disaster relief. So let's continue to remember all of those. Father, we thank you, Lord, that we have opportunities to meet each week, God, to have friendship and fellowship with so many different people. Thank you for the speakers that come each week and enlighten us to things going on in our community. We thank you for our responders here, and thank you for all our military that are helping out in these areas that have been devastated. Continue to remember all those people, we pray. We thank you for our club. We thank you for the opportunity to serve our community, and putting ourselves less and putting service first. We thank you for the food we have eaten today. Ask you to bless our bodies, nourish our bodies, so we might be able to serve not just this community, but all others throughout the world and serve you. We ask all these things in Christ's name. Amen.
Family Rotary, Mr. Terry Duffy.
Thank you, President Rick. Yes, we do have some birthdays, anniversaries to celebrate. On October 7th, we have a pair, Margaret Pooch and Paul Lee. On the 17th, a pair, Stan Session and Colton Carrington. Alex Reynolds on October 18th. Anniversaries, Kelly Pilot and Daryl, October the 7th. Michael Maddox and Rhonda the 9th. And on the 13th is Greg Gregory and Vicky. And then Jenny Logan and Tim on the 15th of October. Willis Smitherman and Lana. Hope you all have a great week. Thanks.
Mr. Alex Reynolds, introduction of guests and visiting Rotarians.
Well, thank you. Good morning. It's great to see everybody, and we've got a great list of guests here today. It's my honor on behalf of the Dothan Monday Rotary Club to welcome our guests. When I call your name, please stand and remain standing until all guests are recognized. Mark Stewart, guest of the club. Claudia Hall, guest of the club. We have Ms. Angela Godfrey, guest of Mark Kristen. We have Mr. Kanye Moore, guest of Mark Kristen. Thank you, guys.
Ms. Tiffany Cambasco. No, 1,587. Last four, 0175. 0175. Six of hearts.
Yeah. Too bad.
Miss Margaret Fudge.
Yes, so I want to proudly announce today, we ended our Infolio Proper Pinky Donut project last Friday. And so we had set our goal at 400 boxes, so we met our goal of 400 boxes. Last year we got 335, and so we did perform that this year. And so with that, we will donate the equivalent of $75,000 from our clubs to Infolio Now campaign. So thank you guys for your generosity and your spirit this year in helping us do that. And so again, I am so proud and honored to serve as the lead champion for this year. And thank you guys. So the pickup day, delivery day is October 22nd. Next week, no, 2 weeks. And so the location is First United Methodist Church, and so we don't have times yet. It will probably be early, right, James? You think? Yeah, probably early. So we'll send that out. But again, thank you guys so much. And I'm really proud and honored to make that next one for you guys. Thank you.
Thank you, Margaret. Just a reminder for the future, November the 4th, which is a Monday. And I'll repeat it for the next few weeks. We'll be having our Monday meeting at the Peanut Festival. So you don't bring anything, you just show up 11:45. November the 4th, but I'll put it in an email to everybody too, probably a week before, just to remind. So I'm sure a few might show up here and realize this. Say I've done that quite a few times. Miss Kelly Powell.
All right, we are 1 week away, so next Monday we will not meet for lunch, but we will meet in here for dinner for our White Elephant sale. So hope everyone can join us. If you'll notice on your tables, Miss Judy Logan has put a list of what we currently have. This is not the full list because we are still getting live auction items in. But she has put so far what we have. Some of those are new things, and some of those are some of our own regulars, which people seem to love. So just come and be ready to bid, and we will have a fun night together. And then we've got last week you might have seen the hot tub that was here, so that will make a fun evening for some folks. As you know, it sounds bad. Now, as you know, all of the money that we raise goes to the Wiregrass Rehab Center, and Paul is constantly trying to, talk to me and let's get some ideas of how we can raise more money and wants to have a big night. And after he saw that hot tub, he started to blow it up and fill it up out here and get in it with his Speedo to raise more money. I said, that would not work. So Thank you. You gonna believe me or a politician?
Wow.
Paul knows that I love him. Today's his birthday, maybe give him a little extra, hard time, so. All right, well, right now, we do have 3 items that we are going to auction off. We have our huge jar of pennies. If you cannot see it, please stand up, because it is large. This was donated, was it last year, Paul? Was the first year?
You
In,
can't pick it
yeah,
up.
we can pick that up.
Open up, Rick.
That was donated, from the family, in memory of Art Solomon, who was a Rotarian.
And Art wanted it to be donated to us.
Yes, Art wanted it to be donated, so as you can see, we do have it. It's a little bit difficult to move around, but we will hopefully we are hoping that's gonna be an item that we can put on display like the other ones and keep auctioning it off every year. We also have our Jack Sasser plaque. Rick is a great man. Thank you, Rick. As you can see, and we are going to start something a little new this year with the plaque. We're actually going to hang that out in our hallway as you walk in, so it's going to be on display out there until each white elephant sale, and your name will be added if you are the winner. And then we have one new item. This was, I don't know a whole lot of history behind this. David Hanks is not here. But David dropped it off at my office one day. This is a clock. I will tell you, it apparently does not work. However, someone may be very handy and do it now.
It's right twice a day.
It is right twice a day. That's a good point. Thank you. But it has a little plaque on the top of it that says, "In appreciation to President Mark, Dothan Club, 1940 to 1942. So you can probably guess now why it's not working. It has been around a while. It apparently is supposed to be wound, and it kind of feels like maybe somebody wound it 1 too many times. But just a little item. Again, I'm going to try to get some more history on it, but it is obviously something that was very precious to not only Mark Cannon, who was the president at that time, but also, he is, correct me if I'm wrong, somebody, he is the one that started our white elephant sale, is that correct? Okay, that's what I thought, so which makes this even a little more valuable. Okay, so Mr. Blankenship, come on up, and I'm gonna try to be ready for you when you scream this time. All right, so let's do the pennies first. I'll do those.
All right, y'all ready? Can you hear me?
We're gonna do the jar of pennies.
Do the pennies. All right, put me on the money here. $5,000 bid anywhere. Now $5,000 bid. Now $5,000 bid. Now $5,000 bid. Now $5,000 bid. Now $5,000 bid anywhere. $500 bid. Now $500 bid. Now $500 bid. Now $500 bid. I got $5,000 there. That's $600 bid anywhere. Now $500 bid. Now $600 bid anywhere. Now $600 bid. Now $600 bid. Now $500 bid. Now $6. Now $500 bid. Now $600 bid anywhere. Now $500 bid. Now $600 anywhere. Now $500 bid. Now $600 bid. Now $600 bid. Now $500 bid. Now $6. Anybody give $600? Anybody give $550? Anybody give $550? This ain't the sale penny. Now $550. All in, all done. Last call, $550. So $500 buyer. Jack. Okay, selling flat. Y'all did a little better than you did last time. You did. All right, put me on the money here. Now $1,000 bid anywhere. Now $1,000 bid. Now $1,000 bid. I'll start anywhere. All you gotta do is say. Now $1,000 bid. $1,000 bid. $500 bid. $100 bid anywhere. Now $100 bid down there. $200 bid anywhere. $200 bid. $200 bid. Now 3. Now 4. Now 5. Now 6. Now 6. Now 6. Now $500 over here. That's $600 bid. Now $500 bid. Now $600 bid. Now $600 bid. Now $500 bid. Now 6. Anybody give 6? Anybody give 600? Anybody give 550? Now 550. Now 550. So $500 right over there.
All right, 7 o'clock. What's it worth? All right, put me on the money here now, $100 bill anywhere now. $100 bill down there, $200 bill anywhere, now, $100 bill, now, $200 bill anywhere, $200 bill, $200 bill, now, there, three, now, $200 bill, now, four, now, four, now, four, now, five, now, five, now, five, now, six, now, six, now, six, now, six, now, six, now, six, all in, all done, now, seven, now, seven, now, eight, times $100 bill, now, $800 bill, where, $800 bill, now, $800 bill, $800 bill, now $1,000, now $1,000, you're gonna pay now $1,000, now, I'll tell you what I'll do, take $950. Now $1,000 bill, now $1150, start with. Now 12, got $1150 over here, now $300 bill, now 50, now 50, now 50, now 50, yes, no, gotta go, now 50.
Claude, Mr. Watson, one to Frank, and who got Kenny's? Jack. Okay, got it. Thank you.
Thank you. John, I guess you got to follow that.
Thank you, President Rick. It's a privilege to have Rick Sutton with us today. He has been here before and spoken with us, but I would like to say just a few words to introduce him before he comes up and speaks. Rick Sutton was appointed as the Chief Executive Officer of Southeast Health and the President of the Alabama College of Osteopathic Medicine in May 2016. Prior to that, Rick has served as Banner Health Senior Executive for all of their Northern Colorado operations from 2013 through 2016. He served as CEO of Banner's North Colorado Medical Center from 2008 through 2013 and McKee Medical Center from 2005 to 2008. Rick has also served in various healthcare management administration positions in the United States Army. He received his bachelor's degree in business administration from the University of Mississippi in 1986 and his master's degree in health service administration from Central Michigan University in 1995. Rick is a fellow in the American College of Healthcare Executives. Please help me welcome Rick Sutton to the stage.
Good afternoon, and thank y'all for allowing me to come back and speak today. Can everybody hear me? I'll stand here. Can everybody hear me? All right, so a little bit about what's going on at the hospital and kind of keep everybody up to speed. There we go. We always start with our mission, our vision. I just like to always start the presentations like that because really it tries to touch on all 5 entities that make up Southeast Health. So everything in our mission vision statement goes to those 5 entities, and we always try to make sure that we hit on those. An aspirational goal for us is to be a top 100 hospital. And so we put that on our wall as a target for everyone to shoot at. We want everyone in the organization to know that is what we are shooting at, because there's a saying out there that staff will never exceed the expectations of the leaders. So if you say you want to be okay, they'll achieve okay. We want to be great. We want to be a top 100 hospital nationally, and so that's what we have our staff working towards. Now when we talk about staff, everybody's heard about staffing shortages. And most people say, well, it's nursing staffing shortages that everyone's struggling with. That's just not true. It's an everything staffing shortage. So that's one of the things that we really are focused on trying to improve is our staffing. And really what we found was we were able to recruit staff. The issue is we were losing the staff if we were bringing them in. So retention became the name of the game. And so we really needed to focus on retention and put strategies in place in order to retain staff so that we could start making headway, get out of this contract labor thing that everyone across the country was struggling with. And so one of the things that we really wanted to do is show there's a saying here, I feel like we're engaged. Well, let's put some data behind it and let's get some input from our staff. And we decided to use what we call Gallup, the Gallup Q12. And so the biggest thing you first start with when you talk about these surveys is you got to get people to participate. So we wanted to measure participation, and you can see that we've had great participation, especially over the last couple of years, as people are becoming more and more engaged and realizing that we do, in fact, take the information that they give us and put action plans in place in order to address any dissatisfiers that they may have. So you can see that even this last year, we were at 92% participation on the survey, which I think really indicates that this is a valid survey. Now, one of the things that you look at is we benchmark ourselves against other hospitals across the U.S. in the Gallup database, and there are thousands. And so you can see in 23, we were in the 76th percentile nationally. So that's top quartile, which is really pretty good, but we wanted to, like I said, we want to be top decile. And so this last year, after we had addressed issues that people had identified the preceding year, you can see that we hit the 88th percentile, which is really strong performance, especially when you think that we had 92% participation from our staff within the hospital. And so obviously we put action plans in place in order to try to address the issues that they have identified for this next year. But really, what's happening from this, right? It's great to have all this survey data, but what's happening from this? We're now down to 76 open nursing positions out of well over 1,000 that we employ. So we have certainly made a lot of headway. When we talk about our open positions, over 3,500 staff, we have about 156 open positions. That's because we're retaining the people that we're bringing in and making people feel valued and dignified and part of the team. They're truly engaged. And so that's what we're really focusing on. And I think that it's showing up in our engagement scores. Really, when you look at it, Forbes has nominated us and identified us as a vested state employer now 3 years in a row. We've run it 4 times, but in the last 3 years in a row, we have been identified by Forbes as a vested state employer. So I think that really is quite important for us, because I believe great organizations don't get there because of their strategies or their theories of management or their executive team. They get there because their staff carry them to greatness. And so if you want to be a great organization, you've got to have great staff that take you there. And I think that this is illustrating that we are in fact delivering on that. Now, when we talk about the community, I know y'all heard a lot of information about becoming Dothan being nominated as Heart-Safe City. First in the state, the only in the state, and certainly first in the state of Alabama. But this is about a program that addresses out-of-hospital cardiac arrest. And so what we do know is that there needs to be immediate intervention in the first 10 minutes when someone is outside of the hospital having cardiac arrest, because you figure EMS is going to be there within about 10 minutes. We just got to bridge that gap from when the event happens till EMS arrives. And so that's where Heart-Safe comes into it. So we have deployed AEDs through a number of businesses in Dothan. We've trained a number of people on hands-only CPR. And when we met the minimum criteria, we were able to designate Dothan as a Heart-Safe city. So then we said, well, let's take this one step bigger. Let's make Houston County a Heart-Safe county. And so that's really what we started on right now. So we started now training outside the city of Dothan throughout the county to make people get them hands-only trained, as well as deploying AEDs in a number of different locations throughout the county. Now, one thing that we are going to do is working with EMS and the fire department on that, and we're trying to really take it up. And so what you're going to see us do starting in January is, in all of the AEDs that we're deploying from January on, that they were also going back to all the AEDs that we have deployed from the beginning of this program. We're going to go also outfit those AEDs with Narcan. We want to put Narcan in there, and we also want to put a tourniquet in there. When you look about the American Heart Association, what they recommend is that every AED has Narcan and some way to stop bleeding. And so that's what we're really going to do throughout the county. And I think that's going to be well received. I think it's something that is really good for our community and good for our county. And so that's what you're going to see, is where you're going to make Houston County a Heart-Safe county, but it's going to be done in a plus fashion. And that's with the Narcan and the tourniquets in there. One thing that we noticed, you're going to hear a lot about, is our Cardiovascular Institute. This really came about when we had some really retirements, we had some relocations, and then we had the unexpected passing of one of the cardiologists really that worked at Southeast Health. And so I gathered with all the cardiologists there at the hospital. I said, what do y'all want me to do? Because they're all independent practices. I said, if I recruit for you, these other ones are going to be upset that I'm siding with this person. If I recruit for myself, y'all are gonna think I'm competing with you. Tell me what you want me to do, because we need to recruit cardiologists. And the overwhelming majority said, look, we want you to recruit for this one practice. And I said, okay, that's what we do. So we set out to do that. Shortly thereafter, that practice said, how about coming, let's build an institute under the employed arrangement under Southeast Health. And so that's actually where the Cardiovascular Institute came from. And so we started building a program and building a line around it. So we have cardiology, we have cardiovascular surgery, vascular surgery, cardiac testing and imaging, and we're going to have additional specialties that are all going to be in one location, which is going to be called the Cardiovascular Institute. What we're really trying to do is to create a situation similar to what you have with cancer, where we now have the oncology clinic, we have radiation oncology and chemotherapy all co-located in one area, which makes it much easier for the patient that's dealing with cancer. We're doing the same thing with cardiology. So that's what you're going to see is we've now started outfitting the building that's just down the road, right across from the hospital, as a Cardiovascular Institute. So there's a number of construction things that are still ongoing, but that's where we're going to be co-locating all of these services at that location. This is the positions that we have right now, but we have others that have already signed and will be joining us later in the next year. So we're going to continue to grow our physician base. You can see that advanced practice providers, we have a number of those that continues to grow. And so we'll continue to build our cardiovascular physicians as well as our APPs for the Cardiovascular Institute. And then as we continue to evolve the services, we'll introduce a heart failure clinic. We'll do something around the mitral valve, and then we'll also look at peripheral vascular disease. And we know all of those things are something that are needed to be addressed in our community. And so we'll continue to look at building those as well. Now, one of the things that we wanted to do was also make sure that we have the hospital looking good. And so when you look at how often things are being renovated, we decided, we can't do the whole thing at one time. So we elected to renovate one floor per year. And so we really started in 17 and in 18. Then we got shut down at COVID and we couldn't do anything. And then now we're able to pick it back up. So we've been doing one floor a year. We now have the third floor under construction. So that's what it looked like not long ago. This is what it looks like now. We'll have our final inspection from ADPH in about 2 weeks. And then we will move the fourth floor down to the third floor. And then we will shut half the fourth floor down, begin renovation on it. That will be the last floor that we have to do to renovate. So we will have renovated all 1 through 7 at the hospital. But that's kind of where we're going to go with that. Now, we're only going to shut down half the fourth floor because that's 42 beds on the floor. And if I shut down half and half, I get to keep 21 beds in operation. And that's something that we're having to deal with continuously right now is capacity issues. And so we're going to go ahead and shut the fourth floor down and just do half at a time. But that's really kind of where we think this is going. So it's really looking quite good. Now, one of the things that I did when I first got here, everybody remembers the optimization. And we did all that in order to make Southeast Health really address the expense issues, really put the hospital back on a financially sound footing. But one of the areas that you've got to do is when you're not making a lot of money, you can't spend a lot of money. And so we decided to take those savings and start recapitalizing the organization. And this just gives you an idea. We made a commitment that we would remain on the cutting edge of technology, not the bleeding edge, but the cutting edge of technology. And in order to do that, you've got to invest. And so this gives you an idea when we talk about our capital expenses, you can see that from 17 to 24, just so y'all, if y'all want to add that up, it's $250 million. And that doesn't include what we're about to invest in our ED project. So we have certainly been really leaning forward out of the foxhole to invest in the organization to ensure that we have cutting edge technology for people that come to the hospital for care. With all that being said, you can either finance or you can pay for it, right? And we are not financing. As a matter of fact, we've been aggressive about paying our debt down. So we have recapitalized it to the tune of $250 million over the past 8 years, while at the same time going from 35% to 17% when it comes to our capital debt. So we really tried to pay our debt down, tried to recapitalize the hospital and remain very, very financially sound. Now, one of the things I've heard about is, this uncompensated care and the tax the tax that Southeast Health is supposedly getting. And we are getting 4 meals, that is true. But I would just point this out that the taxpayer support you can see right there is 4.3 million, and I'm a little over 27 million on uncompensated care. The cost of uncompensated care, not the charges, the cost is a little over $27 million. And so, yes, it helps, but yes, we're carrying a big load to be part of this community. That's something that we all need to shoulder, and we all need to try to take care of that. And we are. We're doing a great job of it. When you look at our total overall expenses, I think you can look at that we're just under $450 million, and you can see that the taxpayer support, the size of the part of that is, it's less than 1%. But now listen, it all matters. Everything matters, and so we appreciate that. But certainly, it's a load that we're trying to carry in order to do this balancing act, remaining profitable while at the same time offering the services that this community needs is quite difficult. And so we really do appreciate what the community is doing for the organization. Now, one of the other things that we've really focused on is, when we talk about being a top 100 hospital, the question is, how do you get there? You can't just say, I want to be a top 100 hospital, and then have everybody start doing it. You got to have a plan, right? And so one of the things that we do know is when you decrease variation, it increases reliability. It happens every time. When you have a highly reliable organization, outcomes go up, cost goes down. It's not just healthcare, it's even in manufacturing. That is true. And so we wanted to really try to standardize the processes and make more and more things in the organization process-driven in order to create that reliable system. And so one of the things that we have received is the ISO 9001. And so many people may not know about that, but it's really a quality organization. It's a quality certification that we have achieved, and it really talks about standardization, squeezing that variation out of the organization through our processes. So we're really proud about that. We're going to continue to squeeze variation out as we continue to move the organization forward on our quality journey. Now, one thing we did do back in 2021 is we implemented what I believe is the best electronic medical record really in the world, and that's called Epic. There's a number of big EMRs out there, but I believe Epic is head and shoulders above the rest. And so we really are proud about that. In 21, we did that. One thing that Epic does is every year they grade all of the organizations that have Epic, and they say, well, yeah, you have Epic, but are you using it? Are you using it to its fullest capacity? Do you have a lot of the toggles turned on or turned off? And so we really try to make sure that we are implementing Epic and using Epic as best we can. Well, they do a grading every year, and it's 1 through 10 stars. And so we've been a 9-star for the first 3 years, and then this year you can see that we were identified as a 10-star. Now, I would point out that Epic has thousands of organizations that have them implemented in their using Epic, and this is the full list of the 10 stars. So it's quite a group of people and quite a group of organizations that are 10 stars. It's not very big, but we're one of them. And so we're really trying to use Epic to the fullest extent possible in order to drive quality. You can see that U.S. News and World Report. We were just notified about that this past year. And you can see some of the things that we're very high performing. And I think people want to know if you're performing. If you're having one of these events, I think you probably would want to know the organization that does really well in it. And so those are something that we're happy about getting. ACOM is a feather in this community's cap, no doubt about it. We have now graduated 1,247 graduates. These are students. Now, these are graduating medical students. Remember, they all have to now go off to residencies to get their specialties of where they're going to go. But the intent was to graduate students from here, send them off to residencies. Residencies range anywhere from 3 to 7 years. And then hopefully we'd have people come back to our community or at least to this geographic part of the country in order to practice. And so that's kind of where we're at. And you can see that, in fact, the mission is being fulfilled. So that primary care, when you look at right here, most graduates in primary care, we had 52% of our graduates were in primary care. The other 48% went into some sort of specialty care this past year. But you can see, rural areas, all of what was envisioned back in the early 2000s, 2010, 2013, was to bring doctors back here. And you can see now that U.S. News and World Report is acknowledging, in fact, the strategy worked. and it's doing quite well. So we're very pleased about that. And it's all, we're going to continue to graduate students in the hopes of continuing to build more and more physicians into our community. So one thing I always tell my team is you got to have a plan. Everyone hears what's going on across the country, but also in Alabama. Right? It's 52 rural hospitals. Half of them are at risk of closure. 16 of them are at immediate risk of closure. We just had one on the western part of the state that closed. You hear about places that are closing certain service lines. It's happening not just here in Alabama, but across the country. So we just need to read the tea leaves. This is what's happening. And what I don't have visibility on is the Georgia hospitals or the Florida hospitals, which we do know that we have rural hospitals in those areas around us. And here's what's going to happen. They're going to receive care somewhere. The question is, where are they going to receive care? And if we know that that's what's coming our way, then we need to have a plan. And so what I tell my team is plan the work and work the plan. So let's come up with a plan. And so that's really what we started looking at. Now, if y'all know back, if you knew we were actually looking at expanding our emergency room back in 2019 because we were seeing the volumes continue to go up. But then when COVID hit, everything bottomed out. No one wanted to come to the hospital because they were afraid they're going to get COVID. And so you saw that it bombed out. But then as we come out of COVID, you can see that we're now exceeding the pre-pandemic levels. And the fact of the matter is our ED is not big enough to accommodate that type of volume. And I believe that if people are going to come here from outlying rural hospitals, the front door of the hospital for people like that is the emergency room. So we know that that number is going to continue to grow, and we need to have a plan about it. When you look at the numbers right here through ED visits, the one thing I would point out, when you look at 2024 to 2019, look at the difference. The issue that you're seeing is not only are the numbers higher, but the acuity is high. So the inpatient admissions, 12,480 was in 19, but now the ones that are being admitted are 14,494. The acuity of what we're seeing in the emergency room continues to go up. And so we know that that's going to affect our inpatient capacity. So I have to have a plan that we're going to also accommodate the ER volume, but what are we going to do about inpatient capacity as well? And so that's something that we really looked at. And then y'all have heard about our expansion. I believe we passed out a number of flyers that y'all can see what we're really getting ready to do with our emergency room. But we're going to essentially double the size of our emergency room, lay it out a little bit differently so that we can accommodate fast track as well as the people that need to go into the back. And also there will be 2 additional floors of inpatient beds that are going to be on top of the new addition. Each floor is going to have 26 beds, so that'll be 52 total new inpatient beds that we'll be putting on top of the emergency room. But remember me telling y'all that I was renovating floors on the east wings of the hospital? By that time, my 4th floor will also be done. And that's an additional 42 beds. So between the 2 inpatient, the 4th floor and the new inpatient beds, that'll give you 94 additional inpatient beds, which we believe should probably accommodate the inpatient surge that we're seeing happen right now. The issue that I think everybody struggles is like no one really knows where the top end is. We believe that this is going to answer the mail, but we will, we'll have to wait and see. So with that, that's kind of a little bit about what's going on at the hospital. If y'all have questions to me that I can answer. Yes, sir.
There's a lot of discussion about people coming into the emergency room that don't have insurance. How many people do you think y'all have coming in that don't have insurance or just come there for not real emergency?
I don't really keep up with that right, or I couldn't answer right off the top of my head. One of the things that we do is we treat regardless of their ability to pay. It does not matter. We're going to take care of them. Our payer mix is the payer mix that we all deal with. I think that most hospitals across the country have the same thing where you have people that come in for what we call urgent care type of items. And that's really when I talk about this new emergency department. When I said fast track, that's really going to be some of those lower acuity things where people are coming in. Probably could have been seen at an urgent care, but we're going to take care of them in the fast track area of the emergency room. But really, the emergency room is not a place where we do look at whether you can pay or whether you can't. Treat everybody regardless of the ability to pay. Yes, sir.
You mentioned the process driven and trying to reduce the variation. Could you clarify exactly what a variation might be for that 5%?
Well, so You know, I'll give you an example. So, when you look across the country, there's probably not 50 best ways to treat pneumonia. Okay? There's probably some national best practices that are out there that have been researched, that have been studied, and says this is the best way to treat pneumonia. Now, my question will be this. If there is a national best practice that says this is the best way to treat a certain disease type, why would we not do it? That would be my question. And so if you can take that from pneumonia, you can take it to heart failure, you can take it to sepsis. There are a number of things that are out there that say this is the best way to treat a certain thing. And I think that we should probably look at going that way. And really what you do is you try to put things in your EMR to help drive that process. We want to make it hard to do the wrong thing and easy to do the right thing. You can do that through hard stops, drop downs, whatever suggestions. But that's really what we're trying to do is look for national best practices that are out there and try to implement those here. Yes, sir.
What level of trauma center are we?
2. Yes,
What we're dealing with the new,
we're going to stay at 2. Yeah. We don't really have the ability to become a 1 with what's required to be a level 1. Yes,
Yeah,
sir.
another question, I'm on Medicare, obviously, and I've got Blue Cross supplement. And I've gone to the hospital before, and when I get my bills coming back or what's been paid, sometimes I've had a $25,000 or $30,000 bill, and yet the hospital and the doctors only get $2,000 or $3,000 or $4,000. Do y'all just write that off or what?
Contractual allowance, yes.
I was just gonna say that my husband and I both are primary caregivers for our widowed mom. And if you guys are not using Epic, I mean, I'm an Epic fan of Epic, and it makes it so easy. If you could get your parents like login credentials, and then when you are trying to have this continuous conversation with all different healthcare providers that they have to see about what's really going on, it makes it so easy. And I can't tell you how much time and how much sickness that we have saved both of our moms by being able to drive that process through the utilization of that portal.
Yeah.
Thank you for that.
It's on my charts. Y'all don't have it, sign up for my chart. There you go.
I feel pretty. Huh?
Just a little.
You gotta be on.
I cut you down some help. So it had.
There we go. Just another reminder, what is next Monday? White Elephant Sale. So what time do you not show up next week? Not for lunch. So I expect to see everybody next Monday night. 6 o'clock. Should be, you can get here earlier. I know some people are rolling in. What do you think, Kelly? 6? What do you-
As we have in the past, probably we're still gonna do the same. First silent auction table will close at 6:25, so the quicker you get here, the better you can shop.
And we're coming college theme. Wear your favorite colors. I'm gonna wear my Auburn stuff, even we're so bad I can't even talk about it. Somebody else lost this weekend too, I think. Yes, they did. We're the big chokers of the world. Board meeting right after this meeting from the board. And, thank you again, Rick, for coming. We really appreciate that. And, let's stand for the, 4-way test. Other things we think, say, and do. Is the truth. They will do it. Will be beneficial for all. Have a happy Rotary Day.